Federal government now says that Nigerians under the Federal Health Insurance Scheme are fully covered, with Professor Mohammed Pate giving that revelation at the National Dialogue. We now bring you the report, and of course, Benny Ark tells us all that happened at the event.
The 2025 National Health Financing Dialogue ended in Abuja after 4 days of discussions on strengthening Nigeria's health system and expanding access to affordable care. Over 2,000 participants attended, including federal and state officials, parliamentarians, development partners, civil society, and private sector, with remarks from the World Health Organization and key ministers.
Work that they have been doing.
The aim is to turn policy discussions into practical reforms. Calls were made for Nigeria to raise public health spending to 20%, cut out pocket costs, and strengthen health insurance coverage.
Nigeria leadership in health financing reform is not only timely, it is a visionary. At WHO, we believe that sustainable financing is the backbone of expenditure. It's a backbone of a resilient health system. This means increasing public health spending at least to 20% of the total health budget, reducing out-of-pocket payments to protect households. Out-of-pocket payment is recycling poverty. Strengthening our pooling and prepayment mechanism and using evidence, not instincts, to guide our decision.
To address us.
Ministers highlighted the federal government's commitment to both reforms in health financing.
With the expansion of the Basic Healthcare Provision Fund and billions of naira that has been disbursed to thousands of primary healthcare centers, with the HOPE program supported by IDA, we're now seeing the BHCPF 2.0, which will add additional 4,000 facilities to benefit from the direct facility financing over the next several months, expanding the footprints of our primary healthcare system, working with states and local government to ensure that Nigerians access the basic care that they need.
Insurance is critical in giving Nigerians access to the health care they need when they need it. And I have no doubt that the scale and detail of this dialogue can only mean robust, actionable, implementable policy proposals that will make our healthcare investments not just possible, not just larger, but also sustainable.
With these reforms on the way and global support, Nigeria's position in health as a national priority and a foundation for future growth. Benny Ark, Channels Television News.